Hi, my name is Janelle, and today I'll be performing a head-to-toe assessment on my client, Natalie, who gave verbal consent for this exam. Before we begin, I will wash my hands, give privacy for my client, and make sure she's comfortable. Throughout the assessment, I will demonstrate what I'm doing and explaining it as well. First, I will inspect her face and check the skin for color and any lesions on her scalp, clear. Do you know what year it is?
2025.
Can you give me your full name?
Natalie Gonzalez.
Do you know what we're doing today?
Head to toe assessment.
Do you know who's the president?
Trump.
As you could tell, she's alert and oriented to her ears with an otoscope. Pulling the panel up and back. Using the otoscope, I don't see any redness or drainage. Pressing on here, does it hurt?
No.
Okay. Other side?
No.
No. Okay, same thing with the otoscope. No redness or drainage. Okay, so I'm gonna do a whisper test on you. You're gonna repeat after what I'm saying. After I cover one of your ears, okay?
Dog. Cat.
Perfect. Stating that her earring is intact, which means that cranial nerve 8 is working perfectly fine. And now we're moving on to her nose, checking for symmetry, any redness or drainage coming out. No. Okay. Can you cover one nostril and breathe out from the other? In out, in and out. Other side. Any issues there? Breathing fine? Okay. And now I'm gonna place this under your nose. Can you tell me what smell it is?
Lavender.
Perfect. And it is indeed lavender, which means that her cranial nerve 1 is working fine. Now I'm gonna palpate her sinuses. Any tenderness or pain there?
No.
I think her mouth, can you open up for me? Lips look not discolored, which is not showing any signs of dehydration. Open. Stick your tongue out for me, side to side. Okay, cranial nerve 12 is intact because it's the movement of the tongue. All right, now can you say ah?
Ah.
Perfect. Cranial nerve 9 and 10 are intact. Let me see right for any lesions or cavities. No. Okay, perfectly good. No lesions or swelling on the tonsils. Alrighty, next I'm gonna check her neck for symmetry. Any bumps or lumps? Feel any pain there? No? Okay. Now I'm gonna ask you to shrug your shoulders for me against resistance. Turn your neck. Other side. Perfect. Cranial nerves 11 are intact and working fine. Okay, so trachea is midline. Can you swallow for me? Good. And now I'm gonna palpate her carotid artery individually. Okay, here we go. Just below the neck. Good. Other side. Oh, very strong. Okay. And now I'm gonna auscultate to see if there's any bruise with the bell of my stethoscope, okay? Good. Good. Moving on to the chest area, we're looking for symmetry. Her breathing pattern is even, unlabored, which is good. And now I'm going to auscultate for breath sounds, looking for wheezing or any crackles, any abnormal findings. Breathe in. Breathe out. Breathe in. Breathe out. Good. First sounds clear. And now we're going to go to the back. Mind standing up for me and turning around? Breathe in. Breathe out. Breathe in. Breathe out. Perfect. Okay, now we're gonna listen to heart sounds starting at the second intercostal space, which is the aortic, and then pulmonic, Erb's point, tricuspid, and the mitral valve. Okay. Okay. Rhythm sounds normal. I didn't hear any swishing sounds. And now with the bell, we'll listen for any heart murmurs. Okay. No heart murmurs there. Moving on. Okay, now I'm gonna inspect the arms and legs and the peripheral pulses. We're gonna check the range of motion on her arms. Good. Perfect. Our radial pulses while we're up here. Good. Checking for clubbing. Okay, we're gonna check for capillary refills on each finger. Less than 2 seconds. Good. And now we're gonna move on to the papillary pulses behind the knees. Good. I'm checking her extremities for any redness or swelling, any tenderness here. Any tenderness? Any pain? Okay. Patient's posture is upright, and I'm gonna ask her to stand up for me and to check for balance. And you're gonna close your eyes as well, okay? Close your eyes. Okay, balance is steady. And this concludes my head-to-toe assessment. I will document any findings and report any abnormalities. And I would like to thank Natalie for helping me out. Thank you, and have a great day.